Good morning, everyone. It's an honor to stand before a team whose commitment keeps medicine safe and patients protected every single day. Today, let's reconnect with the purpose behind our work and rediscover the pride in the vital role each of you plays in pharmacovigilance. Let me tell you a story.
In a vast valley, nestled between mountains of data and rivers of regulations, lived a team of skilled bridge builders. Known not for stone or steel, but for the invisible yet vital structures they created between patient safety and global healing. These were the pharmacovigilance regulators. Every day, new messages arrived. Adverse events, timelines, reports, variations. Each like a log thrown into their already overflowing river. The workload was relentless. Some days felt like storms, others like droughts. These pharmacovigilance warriors fought the tide, coffee in hand, eyes heavy, but hearts still beating with duty. Among them was Mira, a quiet but determined team member. One evening, as she stayed late reviewing another pile of expedited reports, her eyes tired and hands aching, she whispered,
"No one sees what we do, but we still do it. Why? Why do we do this?"
Her manager overheard. He walked over, holding a cup of coffee, and said gently,
"Do you know what a cardiac arrest patient in Brazil, a pregnant mother in Japan, and an elderly man in Canada have in common? They all trusted a medicine that had once crossed your desk."
The next morning, the team gathered for their weekly sync. Manager stood before them and shared a story.
Imagine you're a lighthouse keeper. Storms rage, ships pass, some never even notice your light. But one night, a ship avoids the rocks because of you. You may never meet the captain, but your light saved them. Every PSUR you submit, every DSUR you review, every narrative you write. That's your light. We may be behind screens, but we are shaping the safest possible world for someone who might be holding their life in their hands.
That week, something shifted. Reports still came in. Deadlines still loomed. But the team began seeing not just tasks, but impact. Mira taped a note to her monitor.
"I am not buried in work. I am buried in purpose."
They began supporting each other more, sharing small wins, creating a thank you wall where quotes from patients, healthcare professionals, or internal teams were posted. Months later, their regulatory submissions enabled the launch of a safer, updated formulation across several countries. Patients were better protected, regulators appreciative, and the company proud. Someone asked Mira in a town hall what kept her going. She smiled and said,
"We don't just submit reports. We submit trust. We don't just meet timelines. We protect lifelines."
You may be tired, but you are not invisible. Your work may feel endless, but its purpose is eternal. You are not just processing safety. You are preserving humanity.